Last point is the vaccine. That is the weapon that ends the war. We're going to need a public education campaign to battle skepticism. We have to hit 75 to 85% of the population for the vaccine to be effective. We have 50% of the population saying they won't take the vaccine. That's a problem. We have to outreach to the black, brown, poor communities. That's basic social justice. That has been overlooked. I'll speak to that in a moment. And we have to have the most aggressive distribution administration program, and we're starting that right now. Good news is the 170,000 doses from Pfizer that we announced should be here imminently, Sunday or Monday. We also will get 346,000 doses of Moderna on top of the 170,000, and they'll be here the week of December 21. So the vaccine is coming, and we're ready to administer it. Part of the vaccination has to be the fairness of the vaccination process. I believe during COVID, many inequities were disclosed. Healthcare disparities were disclosed. That's why the death rate for blacks is twice what it is for whites. That's why the death rate for Latinos is 1.5 times what it is for whites. We have to learn from that and correct it when it comes to the vaccine. I don't believe this HHS administration has provided for a fair distribution to black communities and brown communities and poor communities and rural communities and Native American communities across the state. I think they're basically leaving it to the private sector. They haven't given the states any resources to do anything else. We sent a letter to Secretary Azar, who is the political head of HHS. 110 leaders signed on from the state saying that don't continue the discrimination that we have seen through COVID, where black, brown, and poor communities were left behind with higher death rates, higher infection rates. COVID doesn't discriminate, neither should the United States of America. And we're all anxious to do the vaccine. Let's do the vaccine fairly. Let's do it justly. New York State is going to make sure that it makes that point loud and clear, because we're not going to allow this federal administration to proceed with a plan that leaves out certain communities, and the communities that actually need the vaccine most will get it least. That would be the cruelest irony and an added injustice. I believe to leave out those communities is illegal, is unconstitutional, and is discriminatory by effect, if not intent. And I believe this administration knows that. I believe the incoming administration of President Biden will correct it, but we don't want this administration program to start discriminating against people, and we're going to start sending out the vaccine. Let's make sure we send it out fairly with the first vaccine. That's our goal. And we're joined by some special guests today. It's a pleasure to have them with us. We have Congressman Hakeem Jeffries, who needs no introduction in this state. Pleasure to be with Congressmember Karen Bass. Good to see you, Karen. That's our West Coast champion. Congressmember Grace Meng, pleasure to be with you, who's the chair of the Asian Pacific American Caucus, a great New Yorker. Congressman Castro, pleasure to be with you, who's the chairman of the Congressional Hispanic Caucus. And we have Congressmember Deb Haaland from the great state of New Mexico. I was speaking with your governor yesterday, who's the co-chair of the Native American Caucus. Thank you all so much for being with us today. I know you're all busy. I know we wish you all success on that package you're working on. State and local, state and local, state and local. Not that we only have one agenda here, I want you to know. But thank you so much for bringing attention to this issue and for pushing it forward in Washington, because we want to make sure we correct the injustice, and working together, we can do just that. Let me turn it over to Congressman Hakeem Jeffries, who's been spearheading this effort and partnering with us. Congressman Jeffries, thank you so much for being here, and thank you for helping assemble today.
Well, good afternoon, Governor. First of all, thank you for your tremendous leadership here in New York State throughout this pandemic, and of course, in your capacity as the chair of the National Governors Association, all that you've done to address these important issues on the public health side and economic side throughout the nation. It's great to be joined by an all-star lineup of my colleagues in government, in the House, really a congressional dream team. And they have done so much for the caucus, the Congress, and the country. Only Andrew Cuomo could assemble such a great team outside of the halls of Congress. And so this is a critical issue for us. The COVID-19 pandemic has brought a lot of pain and suffering and death to the American people, disproportionately communities of color, immigrant communities, low-income communities, and throughout Indian country. That is unacceptable, unconscionable, and un-American in a country that promises life, liberty, and the pursuit of happiness to everyone, regardless of race, regardless of ethnicity, regardless of region, regardless of zip code. And so we have to continue to press the case together to make sure that as the vaccines become available, that they are disseminated in equitable, efficient, and effective fashion to everyone. But let the dissemination be driven by the data and the need. And we know that that, in fact, is going to be in communities of color and immigrant and throughout Indian country. So I look forward to continuing to work with my colleagues to make sure that the resources are provided here in New York State and throughout the country to make sure that this can be done. It's going to take about $8 billion to do it. The government under this administration has only provided states with about $200 million. That is barely a drop in the bucket, and we're going to work on this issue together. So thank you to my colleagues, and thank you, Governor Cuomo.
Thank you, Congressman. Thank you so much. Thank you for organizing your colleagues. I know they're very busy, and you're right, they are the dream team. I've never seen them on one screen together like that. And I'm glad to have them here in New York. Let's go to Congresswoman Karen Bass, who's the chair of the Congressional Black Caucus, and she is just a superstar for all of us, and she's fighting the good fight, and she's winning. So great to be with you. Pleasure. Thank you.
Thank you. Thank you so much, Governor. And let me just join in and thank you for your tremendous leadership. I certainly haven't had a chance to speak to you, but the way you handled New York State and educated the entire nation at the beginning of the pandemic was just stellar leadership, and we are all very grateful to you for that. As we all know, the way COVID has impacted communities of color has been devastating. And one of the things that's the most devastating is that we really don't know all of the impact, because this administration has to really file the data, to disseminate the data. But we do know, given the underlying health conditions that our communities suffer from, that we know we are dying in certain locations, and one that is going to need, in addition and before the dissemination of the vaccine, is really massive public education to get people to understand the virus, because there has been so much put out there, so that people are comfortable taking the vaccine. And so I am behind you 100%, and all of my colleagues that are here to have to, frankly, until January 20th, until we actually have national leadership that understands that there needs to be a national centralized strategy, we are going to have to fend for ourselves. And one of the things in that strategy has to be focused, concentrated in community color. And so we need to do everything we can to make sure we have state and local funding, but to make sure that we have all of the money that is needed for vaccine distribution. And we need to think of our frontline workers as being first and foremost in that line. So thank you very much for inviting me here today, ongoing leadership.
Thank you. Thank you so much, Congressmember. Thank you, and keep up the good fight. We're going to get there together. We have New York's own Congressmember Grace Meng, who is also the chair of the Asian Pacific American Caucus. So good to be with you, Grace. Thank you.
Thank you, Governor Cuomo. It's great to be here with
Do you hear this?
here in New York and across the country. Your efforts have been such a model for other states, and I commend and thank you for all your tireless work to help Americans combat this pandemic. I think during this past year of uncertainty and lack of sometimes accurate information nationally, I can speak for many of my colleagues and their constituents that your updates daily and weekly have provided a very important and reliable source of information and helping us to save lives. Thank you always to my good friend and our caucus chair, Hakeem Jeffries, for his tremendous vision and steady leadership that you have provided during this pandemic and that you have brought to our caucus. It's always exciting to be here with this dream team. Chairman Karen Bass, one of my favorites in Congress, if I could say that. Chairman Joaquin Castro, and our superstar, Deb Haaland. It's always an honor to be with you, and I appreciate all of you. As you may know, my congressional district is actually in Queens, New York. We were at one point a few months ago, one of the epicenters of this pandemic. Elmhurst Hospital, which was one of the hardest hit hospitals in this country, is in my district, and the facility was at the heart of this epicenter. And the impact COVID-19 has had on our communities of color, and particularly Asian, Black, and Latino, Native American throughout this country, has been really troubling. Asian Americans were impacted early on, not just by the virus of the coronavirus, but by the virus of discrimination and hatred. And I stood with this exact group of leaders nationally as they stood shoulder to shoulder with the AAPI community to condemn discrimination against Asian Americans. The CDC says that Asian Americans' rate of hospitalization and deaths is almost 1.5 times more than whites. And so we've seen that this pandemic exacerbated already existing vulnerabilities, inequities, disparities, particularly in access to healthcare, and including language barriers, financial obstacles, et cetera. We must work together, as our governor said, to ensure that immigrant and minority communities have equal access to the COVID-19 vaccine, that there is a fair, effective, and equitable distribution, that communities of color know when and how to get this vaccine, and there must be engagement and outreach with local grassroots groups, faith-based organizations, and nonprofits to assist with getting this information out. One of the things that I was concerned about, and I was proud to partner with Governor last week, and he really led the charge in working with the Health and Human Services and the CDC director to ensure that information, private and personal information that identifies recipients of the vaccine would not be shared unnecessarily with other agencies in the federal government. I'm proud to announce, as you already know, actually, that Governor Cuomo was successful in ensuring this result here in New York, but we must continue to work with the CDC and the health department to ensure that every other state achieves the same solution and protection. So finally, there must be adequate federal funding to implement this vaccine distribution. States cannot do this alone. The federal government must be there to support the efforts of states. I have continuously urged with my colleagues, Senate Majority Leader Mitch McConnell, to pass much needed coronavirus relief money like we in the House done repeatedly. We know that Governor Cuomo and his team are working nonstop to ensure access to the vaccine for every New Yorker, to knock down barriers that have allowed disparities to exist in the past. We commend him, stand with him, and continue to be partners with him as we continue to save lives here in New York and throughout the country. Thank you, Governor.
Thank you. Thank you very much, Congressmember, and thank you for all the help. You're exactly right on the stopping the HHS policy, which would have identified undocumented people before they got a vaccination, and I think would have been a real exclusion, frankly, of the undocumented community. And we raised that issue, and with the help of this dream team, HHS actually changed their position, and the state can now do the vaccination of the undocumented community without identifying them. So that's a big step forward. And I think they're going to hear us on this issue also. Let me turn it over to Congressmember Castro. Pleasure to be with you again, and the chair of the Hispanic Caucus. Thank you very much for joining us, and thank you for your good work on all of these issues. Congressmember.
Well, thank you, Governor Cuomo, and thank you to Hakeem and to all of you. My connection is a little choppy, so I apologize for picking up a bit. But I want to say thank you for meeting us, Governor. Thank you for your efforts. As my colleagues said, particularly during the early days of COVID-19, conferences were reassuring not only to me, but as has been said, we need to make sure that there is full and effective funding for the distribution of COVID-19 vaccine, but especially to the most vulnerable Americans. I think it's safe to say that every American community has been impacted one way or another by COVID-19. In some communities, have been especially devastated. And that includes the Latino community in the United States. When this pandemic started, it was clear that Latinos were likely to not be able to go home. They comprised a great share of the essential workers, and they have been especially hit hard by COVID-19. Higher rates of infection, higher hospitalizations, and higher rates of death than many. And at the same time, we know that when it comes to things like census responses, getting information out to communities, that Latino communities become engaged. And so it's going to be imperative on all of us, the federal government, the state government, to make sure we do everything possible and spend money that we need to get that vaccine to all of our communities. So as we think about our priorities, making sure that we're getting it not only to frontline healthcare workers, but also to those folks who are essential workers, like teachers and grocery store workers, meatpacking workers. All of these folks who literally were endangering their health, and some of them endangering their lives to make sure that our country was able to. And so thank you for bringing us together today and for the for all making.
Thank you. Thank you, Congressmember, and thank you for your leadership. And don't worry about the presentation being a little choppy. I'm always a little choppy, and it has nothing to do with the technology. It's just my presentation. So thank you very much. Let's go to Representative Haaland. It's a pleasure to be with you, co-chair of the Native American Caucus. I was former HUD secretary, and as Congressman Castro knows from his family, I spent a lot of time working with the Native American community, and their needs are desperate, and they've been made more desperate from COVID. So thank you very much for being with us.
Thank you so much, Governor Cuomo. Thank you for your tremendous leadership and for your allyship. It's always a pleasure to stand in solidarity with our chairman, Hakeem Jeffries, and with the Tri-Caucus leaders fighting for equity for our communities of color. Here's the simple truth. The federal government has failed to honor its promises to Native Americans for generations. There are places in Indian country where there isn't running water. How can we expect folks to follow hand washing guidance without water? There's not broadband internet to ensure access to telehealth and for kids doing their homework virtually. And in some places, there's no electricity. Over the course of this pandemic, history repeats itself, and a spotlight has been put on the disparities that have existed for far too long. The virus has ravaged our communities, and the Trump administration has once again failed to provide the resources needed to protect the health of Indian country. For example, the Navajo Nation had infection rates higher than any state. In New Mexico, Native Americans are 11% of the population, but have been up to over half of the state's COVID-19 cases. And like my colleagues have discussed here today, American Indians and Alaskan Natives suffer disproportionately from health conditions that exacerbate COVID-19. The federal response to COVID-19 in Indian country is unacceptable. Far too many people have died, and the White House has gone out of its way to fight against providing direct aid to Native nations. And now vaccines are here, but again, a comprehensive plan that will serve all people is missing. We have the opportunity to correct a history of the federal government toward Native Americans. Tribes need robust information and education on the vaccine to increase confidence, resources to make up for gaps that existed for generations, and the flexibility to develop their own district plans. Thank you again, Governor, for having me and having us, and I'm very proud to be here today.
Thank you very much. Thank you very much, all of you. And look, I believe that we will get changes to this vaccination program. I think it's important that we articulate it and we design it. If the Trump administration doesn't make the changes necessary, I believe that it is illegal, and we'll pursue that course because we don't want to get off to a bad start, and it shouldn't be that newly elected President Joe Biden is going to have to correct a mistake so early. So we'll do it right, and then we'll focus on the disparities that we learned through this COVID situation and the healthcare deserts and all the inequities that existed in the first place that manifested through COVID. And the agenda will be to make sure not only COVID never happens again, but we answer those inequalities once and for all. God bless you. Thank you so much for taking the time to do this. Congressman Jeffries, thank you so much for organizing today. And to all of you on a personal level, I miss you. I can't wait until we're together again in person. And God bless you for the fight you're fighting. Keep going.